Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek Da Silva. This week, we're taking a look at two advances in the fight against cancer. The first one is one of the most revolutionary radiosurgical technologies in the world. It is called CyberKnife. Only 5 hospitals in New Jersey have this technology, and get this, it doesn't even exist in Manhattan. Here to tell us all about it is Dr. Adnan F, a radiation oncologist and medical director of the CyberKnife Center at Riverview Medical Center. Also here is Douglas Haig, who was successfully treated for prostate cancer with the CyberKnife. Gentlemen, welcome to the program.
Thank you.
Doctor, let me start with you first. What is the CyberKnife?
So CyberKnife is a unique radiosurgical technology. What it does is it allows us to focus high doses of radiation with tremendous accuracy to focal targets anywhere in the body. Radiosurgery was initially invented to treat brain tumors, but our thought was, well, a tumor is a tumor no matter what the location, so why not apply that theory to other parts of the body? So the CyberKnife allows us to do what we did for the brain for tumors anywhere in the body. We can treat tumors with the lung, with in the prostate, pancreas. So over here in the video, what we see is the CyberKnife. It's attached to a robotic arm that has 6 degrees of motion, and to the robotic arm is attached a miniaturized linear accelerator that accelerates high dose of radiation to the targets that we identify.
So it isn't a knife. It's not involved in cutting, is it, or what is it exactly?
Absolutely not. It's not a knife. It's a completely non-invasive procedure to treat tumors. It's a very unique name, I suppose, but it's not a knife at all.
Okay.
There's no general anesthesia involved. There's no recovery. There's no cutting. There's no stitching. It's completely non-invasive.
Doug, what about you? You were diagnosed with prostate cancer.
Right.
We know all the symptoms of prostate cancer. We've done shows on that. But why did you choose the CyberKnife?
I'm familiar with medicine because I was a trial attorney a long time ago. Tried a lot of cases, and I try to keep up with it. And my perception was that of all the advances that I was checking out, I thought that CyberKnife was would be the most successful. The only problem was back when I was diagnosed, there wasn't any CyberKnife here in New Jersey. It was in Oklahoma.
How long ago was that?
About 5 years ago.
So, Doctor, what about the advantages of the CyberKnife over other technologies, and what other things or other therapies can we use the CyberKnife for?
So the main advantage of CyberKnife, especially in treatment of prostate cancer, is the reduced time in which it takes to treat prostate cancer effectively. What we found, our 5-year data and 10-year data now shows that the effectiveness of a 5-day regimen is the same as what you might get with the 42 or 43-day regimen. The usual standard regimen to treat prostate cancer with radiation takes about 9 weeks, but now we can accomplish the same goals within a week with the same level of success and the same level of complication risk.
So the complications are less, correct?
The complications are just about the same. You have the same.
So then what's the advantage if the complications are the same? Is it just a timing?
The main advantage is the convenience. The main advantage is the fact that you can get your treatment done in a week rather than having to come to a radiation therapy department every single day for 9 weeks, 15 minutes a day. You come to a CyberKnife center and get treated 1 hour a day for 5 days, and you're done. And the reason we can do that is because the high level of accuracy of CyberKnife, because you can focus high dose of radiation to the prostate, minimize how much goes to the rectum and the bladder, and thereby give a higher dose in a day than you can with conventional technologies.
And Doug, can you just talk to us a little bit about your experience? You went and did the procedure. Give us a little run through of what happened.
Well, what happened was I was about to do seeds. I had given up on CyberKnife because it wasn't available. And when I sort of targeted in on the seeds, I was about to have it done, I realized that I'd be radioactive. There'd be 100 seeds in the prostate. And about the time I was ready to commit to that, a friend of mine who's a judge in Monmouth County called and said Riverview had a CyberKnife machine. And that was the option for me, because when I was given that option out in Oklahoma, I said I'd rather die in New Jersey than go to Oklahoma in the winter.
Right.
So.
What about prognosis for Doug?
Excellent. I mean, so far
Point
he hit it.
0.04 on the PSA scale.
He had an early stage prostate cancer, which is very treatable, very curable, and so he's done remarkably well. But he's done just as well as most patients have who have been treated with the CyberKnife. I mean, so far the 5-year published data has shown excellent control rates that's equivalent to what the more conventional technologies, and the 10-year data that's now being presented also shows equivalent outcomes. So really the main advantage here is, get treated within a week, non-invasive. You can continue to work even during that week of therapy, and have minimal effect on quality of life.
Very good. Thank you for joining us.
Thank you.
Pleasure to have you here.